The ketogenic diet, or Keto for short, has been in recent years more so used as a diet for weight loss. However, 100 years ago, this was not the case. It was actually developed by Dr. Russell Wilder in 1923 as a treatment for epilepsy. Hey guys, welcome back to my channel. My name is Irene and I'm a registered dietitian, and today I want to talk about the ketogenic diet. So as some of you may know, I recently started covering keto patients at my hospital, and I have learned a lot about the ketogenic diet as therapy for neurological disorders, and I thought that it would just be a good opportunity for me to share this information with you guys, and also for me to solidify my learning by teaching it to someone else. So I want to start off by kind of going through the scenarios in which you would use a ketogenic diet. So originally 100 years ago when this diet was developed, it was used for seizure treatment. However, over the years, scientists and clinicians have found that it could be used for other neurological disorders as well, including mitochondrial disease, brain cancer and tumors, Alzheimer's disease, Parkinson's disease, and a few others. So I am most familiar with the ketogenic diet used for epilepsy treatment and also in mitochondrial diseases because I work in pediatrics, so I will primarily be speaking about this diet in this specific setting. For patients with epilepsy, the ketogenic diet works about 50% of the time to provide a 50% reduction in seizures, and about 10 to 15% of patients will actually see a 90% reduction in seizures. There are certain conditions like Lennox-Gastaut that have been found to have greater improvements with the ketogenic diet, especially when patients have failed medication therapy, which is usually when the ketogenic diet comes into consideration. Other times, patients that have mitochondrial disorders may be started on the ketogenic diet a couple months after their diagnosis, even if their seizures are well controlled with medications, and that is because it's actually best for these patients to be on keto for life since their bodies can't actually process carbohydrates properly. So being on the ketogenic diet is going to help them with their brain development and growth as well. Whereas epilepsy patients, they can usually come off the diet after 2 or 3 years of being on it and still retain the benefits that they had while they were on the diet of being like seizure free or having a reduction in seizures. But even though the ketogenic diet might be beneficial for some patients in terms of seizure control, there are other considerations that need to be reviewed before starting the ketogenic diet on a patient, and that includes things like what the primary source of nutrition is for the patient, lab work, and also overall fit and just logistics. So a lot of my patients on the ketogenic diet are actually tube fed, and this does not come as a surprise because imagine trying to get a toddler to eat a specific amount of carbs, protein, and fat every day. Like that would be extremely hard, especially if they're a picky eater. So with tube fed patients, it's really easy. We're feeding them formula and it's going through a tube, and most of the time the patient is not refusing this. So it's significantly easier to put a tube-fed patient on the ketogenic diet versus trying to put a PO feeder on the ketogenic diet. With my PO feeders though, we do have recipes that we can give them that will include a specific number of grams of carbs, protein, and fat, and it's gonna be a recipe with the foods weighed out in grams. So for example, one of the recipes might be a stick of butter wrapped in bacon, and it's gonna be a specific amount of butter weighed out in grams and a specific amount of bacon also weighed out in grams. And the parent has to make sure that the patient eats both the whole stick of butter and the whole like slice of bacon or whatever it is. And if the patient eats just one or the other, the parents are going to have to figure out another way of getting in the missing carbohydrates because that might throw the ketosis out of whack. So if you can imagine, this would be extremely hard for picky eaters, and they probably would not make it through like the screening process of getting onto the ketogenic diet. So another consideration for the ketogenic diet is lab work. So because this diet is so high in fat and it hinges on a patient getting into ketosis usually at levels between 3 and 6, there is a lot of lab work that is involved. There's a ton of lab work before the patient is initiated on the diet to make sure that there aren't any other metabolic disorders that are contraindicated in starting the diet. And then once a patient is started on the diet, there's regular lab work, usually about every 3 to 6 months, just to make sure that their lipids are still in check and they are still in good levels of ketosis. If a patient is found to have really high lipids and we're not able to like bring it down in another way, that might be an indication actually to take a patient off of the ketogenic diet. And lastly, overall fit and just logistics is a huge factor in determining whether or not a patient is fit for the ketogenic diet. The parents of kids on the keto diet have to be very hypervigilant of what the patient is eating and the body products that are used, and they just have to be very on top of things in general. It just isn't gonna work if parents aren't really like totally on board with things. And it can be really hard for a patient to remain on ketosis, especially if the family is not cooperative or if there's like other situations going on with the family. So that really plays a huge factor in determining whether or not the ketogenic diet is appropriate for a patient. Moving on to what the ketogenic diet actually consists of, let's start with some of the similarities between the ketogenic diet for neurological disorders and the popularized like diety keto. So for starters, both diets focus on limiting carbohydrates in the diet to induce ketosis, which is a metabolic state in which your body starts using fat as its main fuel source instead of carbohydrates, which is what is normally used. And that right there is pretty much the only similarity between the two diets. The keto diet for neurological disorders is a lot more strict and precise. So within the scope of ketogenic diet therapy for neurological disorders, there are several different types of ketogenic diets, but all of them require a commitment to staying on a specific ratio of fat to protein and carbohydrates. So the main types of ketogenic diets include classic keto, modified keto, MCT, modified Atkins, and low glycemic index treatment. So the ketogenic diets that I have the most experience in are the classic keto diet and the modified keto diet. In these two diets, the focus is the ratio of fat to protein and carbohydrates. So usually the typical ratios are 3-to-1 or 4-to-1. Sometimes we have like ratios in between, like a 3.5-to-1 or a 3.25-to-1. And basically what this means is, say for example, if we have a 4-to-1 ratio, which is very classically keto, that means for every 4 grams of fat, you only get 1 gram of protein or carbohydrates. So this pretty much is essentially 90% fat diet. It is very strict and very different from like the popularized keto diet, which mostly is just limiting the total number of carbohydrates that you eat in a day, and it doesn't limit the protein. So the reason why we also want to limit protein on this therapeutic diet is because if you eat excess protein, it also gets converted into carbohydrates in the body. So if you eat too much protein, it could also take you out of ketosis. So in the modified Atkins and the low glycemic index treatment diets, the ratio of fat to protein and carbohydrates is a little bit more relaxed, and we typically use these diets for like PO feeders and usually like teenagers, because this provides a little bit more flexibility in the diet and just better overall quality of life. So in these diets, the ratios are usually like a 1-to-1 or 2-to-3, so about 60 to 70% of fat in the diet. These diets don't necessarily induce ketosis in patients, but they can still offer very similar benefits to the traditional keto diet in terms of seizure reduction in some patients. So once a family has decided that they would like to proceed with starting the ketogenic diet, they will require careful supervision from a medical team, including a neurologist and a dietitian. So at the hospital that I work at, it is a week-long admission that is pre-planned. So families come up for a week. There are daily labs that are drawn, and it's a huge commitment for the family. It's not something really that is recommended to be done at home, because sometimes starting on the ketogenic diet could result in an imbalance in acid base in the body, which could cause some pretty serious medical complications. So it's really important that it is done under medical supervision and that you are being guided by medical professionals that know what they are doing. So with patients on the ketogenic diet, we also have to be careful of the medications that we give and also the body products that we use, including things like soap, lotions, toothpaste, etc., because anything that we put on the body can be absorbed, and obviously medications that we're ingesting are also absorbed as well. So it is recommended that parents buy products that don't have carbohydrates in them, and that liquid medications not be given to children on the ketogenic diet because they could contain carbohydrates. There isn't a whole ton of data regarding like body products and whether or not they really do affect ketosis, but there is a little bit of risk about it. So that's why we tell parents to avoid any products with carbohydrates in it, especially because for kids on the ketogenic diet for epilepsy, breaking the diet in any sort of way by consuming extra carbohydrates, like whether you're ingesting it or it's like being applied topically, and if that affects your ketosis levels and you like break the diet, the patient could start having seizures again and could be hospitalized. So it's really important for the patient and family to be very strict on the keto diet. So all in all, the ketogenic diet for neurological disorders is a very strict and precise diet, and it requires supervision from a team of clinicians, including a neurologist and a dietitian. And it also requires an immense amount of cooperation from the family to ensure that the patient is staying on the diet, because breaking ketosis or breaking the ketogenic diet could result in increased seizures and possible hospitalizations. And it's really very, very different from the popularized keto diet used for weight loss. And it's really important to understand that there are these differences, especially if you're working in the medical profession. So I hope that you enjoyed this video and found it informational. If you did, please be sure to give it a like and subscribe, and I'll see you next time. Bye.